If you're having knee pain due to arthritis and you are contemplating surgery, or you want to avoid surgery altogether, then this video is for you. In this video, you are going to gain a better understanding of how load on the knee impacts knee pain if you are someone that has knee arthritis. And with that understanding, we are going to go into some modifications that you can start making today and how you move throughout your day to dramatically decrease the amount of knee pain you experience with your walking and potentially avoid knee replacement surgery altogether. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset with the end goal of empowering you with as many tools as possible to take full ownership of your health and your overall mobility, to live an overall more active, more mobile, pain-free, happier, healthier life. And today we're going to cover a topic that I'm super passionate about, and that is how to avoid total knee replacement surgery. I've been a therapist for over 22 years, and I've worked with people on both sides of that equation, people before surgery that were able to avoid having knee surgery, as well as people who have had knee surgery. And all that said, I think there's a huge opportunity to decrease or avoid surgery altogether. And if that is what you want as well, I want you to have hope that it is possible to avoid knee surgery. So this is going to be part one of a two-part series that we're going to do. Today we're going to cover ways that you can modify the way you're walking to decrease your pain. And in part two, we're going to cover exercises, whether you're planning on having surgery or not, exercises that if you have knee arthritis are absolutely essential to decreasing your amount of pain, decreasing weakness due to learned non-use or compensation, which whether or not you're already scheduled for surgery or you're trying to avoid surgery, then you're going to want to do some exercises to either prepare you for surgery or avoid surgery altogether. So if you're not yet subscribed to this channel, definitely hit that subscribe button and turn on that notification bell so that you'll get notified when part two of this video posts. But enough about that, let's go ahead and dive into the meat and potatoes of this video, and that is really understanding how load on the knee joint impacts your pain. And depending on what literature you read or what scientists you listen to, there's going to be a little bit of a variation in people's opinions on this topic. So just keep that in mind. Take everything I say with a grain of salt. This is just one viewpoint of looking at load on the knee. But most scientists in this area agree that most knee pain that eventually results in requiring knee replacement surgery is when there is excessive load on kind of the inside of the knee. So how does that excessive load happen on the inside of the knee, which causes, for those of you that don't know, which causes the breakdown that creates the rubbing, that creates the pain on the inside of the knee? And that is this motion right here. So what causes this motion right here? If you can see, this isn't a great example, but it's the best that I can do with this model. Well, what I hope you see is kind of like a V or a greater than sign facing me. Okay, so this would be a less than sign. I'm going to call this kind of a greater than sign. When your knee starts to do that motion, there's excessive force on this side of the joint. So in this video, what we're going to cover is how do you decrease that force on this side of the joint, right? Because in theory, that's going to decrease the amount of pain that you're having when you're walking. Okay, so keep that in mind. We're going to work on how to decrease that moment, that force right there when you are walking. Now, when do most people experience the most pain? It's at heel strike, so it's when the heel hits the ground, and at toe off. That's going to become important not just for this video, but for the next video that we talk about when we talk about exercises. They know that that's when that force is the most. And if you're someone that has knee arthritis, you probably already know that. And what most people do to avoid that, one way, we're going to go over several, is you just keep a little bend in your knee and you kind of skip over this phase altogether and you just kind of go to this phase of the walking, okay? So you're skipping over that phase, and that's going to become important when we talk about walking, okay? So that's one potential thing. The other thing that people do to kind of offset that load or that force that goes into this side of the knee right here is you lean your trunk to one side. You lean your trunk towards the side of the painful knee. Okay, so when you do that, again, that just evens out the forces a little bit and puts less force on that inside component of the knee. Okay, so just keep that in mind. You might notice that you do that, so that's really, really important. So I might not be telling some of you anything new. You might already know that you kind of do that. You kind of have like a waddling gait. Just know that that is because your brain is compensating or subconsciously trying to avoid that force on that inside of the knee, and it's helping you with your pain. So that's what's causing some of the kind of weird things that you're doing when you're walking if you are someone that's had arthritis and you notice a change in your walking pattern. Other things that we know contribute to that load or increases the amount of load on that inside part of the knee is walking slower. So this kind of makes sense if you can just visualize when we walk, we move our center of gravity over that foot. The slower you walk, this is just how I'm envisioning it in my head. There's just more load for a longer amount of time through that inside of that joint. So most of you already know this because you probably do slow down or you have slowed down your walking a little bit, because that's what a lot of people will do when you're having pain, and that might actually be increasing the amount of pain that you're having in your knee, and that is also very important to be aware of. Okay, so now that we understand the loading and how we compensate to avoid that knee pain, let's talk about things that they think might assist in decreasing that pain. Again, it depends on the person, and anytime I make a video on arthritis or painful arthritis, I always want to make a point to note that arthritis is inflammation. They know that there's inflammatory chemicals that they can test inside the fluid in the knee joint, and painful arthritis, there are those inflammatory chemicals in the knee joint. Why do I tell you that? I have a video on chronic inflammation and some of the things that contribute to like a systemic chronic inflammation. And I do think that inflammation plays a significant role on whether or not just degeneration of a joint actually becomes painful. So I want to make sure that that's very clear as well, that just changing the way you walk might not be enough. If you really want to avoid surgery and you want to be able to walk with less pain, definitely you want to have a better understanding of chronic inflammation. I will put a link in the description below of a video that I've done on that. But now let's get back to what can you start doing today to walk with less pain? All right, so the first gait modification we're going to go over, which is the absolute easiest because it doesn't require a whole lot of thought, is to use an assistive device in your opposite hand. So if this is the knee that's hurting, then just using an assistive device in the opposite hand. It does two things. It does change the forces on the knee, which we'll go over in a minute. But remember, I also talked about walking slower increases the load or the ground reaction force, the force that comes up through your foot and pushes up into your knee. It increases that force. So if you are hesitant to use an assistive device and you know that your walking is slowing down, just be mindful that it could be the simplest tool that you could be using right now to decrease your pain, increase your walking speed, decrease the load on the knee joint, and potentially avoid surgery. So assistive device, opposite hand. Now the other thing that does, remember I said if this is the knee, I said there's this lateral trunk lean that some people do to compensate for that pain. Now what that does is it takes the load off the inside of the knee and it kind of puts the load on the outside of the knee. So what an assistive device does is it actually allows you to get that center of mass, your body, the heaviest part of your body, in better alignment over that joint, so it's distributing the forces more evenly throughout the entire knee joint versus putting more of that pressure onto the inside of the knee. Okay, so number one modification you can make if you have knee arthritis that is painful to decrease the amount of pain and hopefully potentially walk longer distances is using an assisted device in your opposite hand. Now, sticking on the theme of gait modifications that you can do, remember I said that it's that load on the inside of that knee joint that is causing that pain. Now, the other thing we know that happens that creates that load on the inside of the knee that I don't think I mentioned earlier, but I'll mention it now, is that your tibia, this bone right here, actually rotates this way. So it actually rotates inward, again, putting that force on the inside of that knee. The next kind of, I say, easiest or lowest hanging fruit, I think some people say, because I think it requires the least amount of thinking, is to walk with your toes slightly out. Okay, so what that does is it rotates that tibia kind of outward a little bit and will, again, if you're having excessive force on the inside of the knee, kind of distribute those forces more evenly throughout the knee. So that's gait modification number 2. Gait modification number 3 is a little bit controversial. And like I said, if you don't immediately feel relief with one of these walking patterns, don't do it, because there's always a trade-off. Anytime you're modifying your walking pattern, you are just kind of potentially putting yourself at more risk for having some sort of an overuse injury somewhere else. So if you don't immediately feel relief when you try one of these gait modifications, don't continue to do it. And again, this one's kind of controversial, but remember, this kind of a load right here is what is creating that load on the inside of the knee or creating that pain. So one potential thing that you might want to try is to kind of think about bringing your foot, not your entire leg, but your foot kind of around the side. Now, the reason I say it's controversial is because many, many times people come to me with that kind of a walking pattern because they're having pain, and we try and do things to kind of minimize that or kind of more normalize their walking pattern. So again, if you don't immediately feel relief when you try this, don't do it, because there's no real benefit outside of just giving you some pain relief. But again, kind of bringing that heel around the side. Now, what's going to be a little bit of a more challenging thought or modification to make to your walking is to combine the two. So bringing that heel around the side, but then during standing, toeing out. Okay, so that is a lot. But the reason I bring it up is sometimes your brain is so consumed with the pain, because obviously you're in a lot of pain, that it could be a similar amount of like cognitive burden. You're just kind of shifting it away from the pain and in your mind, and then your subconscious trying to figure out a way to kind of find that place where you're not having pain. You're just going to take that cognitive load if possible, and you're going to think whip, toe out, whip, toe out. Okay, so it's whip it around, toe out. All right, whip it around, toe out. And again, if you don't get immediate relief, you don't need to do it. Okay, so that is the gait modification. But one last topic I want to cover before we finish are modifications that you can do to the things covering your feet, i.e. your shoes. All right, first shoe modification we're going to talk about is a lateral wedge. Now, what I do for this, because it's really hard to get a lateral wedge inside your shoe, if you go to an orthotics company, they can build a lateral wedge in the sole of your shoe, and it's in my area, it's relatively cheap. It's like $20, and they make it look good. They match it to the color of your sole. It looks really good when it's done versus trying to find things that fit inside your shoe, which can be a challenge. Okay, but one is a lateral wedge. Now, what does that do? Remember, the load is on the inside of that knee joint. We know that that tibia rotates inward along with that load on the inside. So what a lateral wedge does, if you can visualize this, if I have that lateral wedge, it just kind of opens up or gaps that inside of the joint a little bit. This is aggressive. This is not, I'm just using this as a demonstration to kind of show you how changing that foot position or the angle of that foot will change the forces on the knee. But you can see that that could potentially kind of gap that joint inside of that joint right there. And then the last thing that we know increases load on a knee joint or increases the amount of ground reaction force is a thick soled shoe. So I know those rocker bottom shoes have become really famous lately. Hoka's have become really famous. And I think a lot of people purchase those shoes thinking that, oh, it's soft, it's cushioned, it's going to decrease the amount of force that's going through the knee. We know that a thick-soled shoe increases the ground reaction force going through that knee joint. So if you're in a really thick-soled shoe, maybe just going to a standard New Balance, and then from there going even lower. Not sponsored, but I wear a brand called Olukai. They're pretty low profile and they have good arch support. They're super comfortable. So this is a brand that I like. I would consider this kind of a low profile shoe. Again, that brand is Olukai. Again, not sponsored, but I do think it is a great shoe. But then that is it for this video. As a reminder, don't forget there is going to be a part 2 because there's another huge component to this, and that is doing the correct exercises around the knee and the hip joint to decrease pain, but also maintain the strength of some of the muscles that you might not be using because you are compensating a little bit, which might not just have a benefit on your pain now, but it will definitely speed up your recovery to have those muscles very, very strong if you do plan on having surgery. But I hope you guys found this video helpful. If you did, please hit that like button, hit that subscribe button, turn on that notification bell so that you'll get notified when part 2 of this video drops. I enjoyed spending time with y'all today, and I'll see you in the next video. Have a good day.